The EHR workflow and components. Understanding the core components of EHR systems. EHR systems are designed to capture, store, and manage a wide variety of patient health information. Key components of EHR systems include patient history. Personal information includes basic demographic data such as name, age, sex, address, and contact information. Medical history, details about the patient's past and present conditions, surgeries, allergies, immunizations, and family history of diseases. This helps healthcare providers understand the patient's background and potential risks. Social and lifestyle information. This section records relevant social history, such as smoking status, alcohol use, occupation, and lifestyle choices that may impact the patient's health. Medications. The EHR includes a list of current and past medications the patient has been prescribed, including dosages, frequencies, and durations. This helps prevent medication errors, interactions, and ensures accurate prescribing. Medication history. In addition to current medications, this section tracks medications prescribed in the past, any allergies, and responses to certain drugs. Laboratory results. EHR systems integrate lab results, such as blood tests, imaging studies, and diagnostic reports. These results can be stored and shared for better care coordination and monitoring over time. Results are typically shown with timestamps, facilitating easy comparison over time and aiding in clinical decision-making. Vital signs and clinical data. This component includes measurements like blood pressure, heart rate, weight, temperature, and oxygen saturation levels, among others. It also includes clinical notes written by healthcare providers during patient encounters, such as physical examination findings, assessment notes, and treatment plans. Immunizations. A section in the EHR records a patient's immunization history, which can be important for preventive care and tracking vaccination schedules. Diagnostic imaging and procedures. EHR systems also store information about diagnostic tests, X-rays, MRIs, CT scans, and other imaging procedures. These results, often with images attached, can be reviewed and used to guide treatment decisions. Care plans and treatment orders. The EHR captures care plans and treatment orders created by healthcare providers. This includes information on treatment goals, follow-up appointments, referrals to specialists, and any other instructions related to a patient's care. Patient communication. Some EHR systems include tools for direct communication between healthcare providers and patients, such as messaging services, appointment scheduling, and reminders for follow-up care. How EHRs are used in different healthcare settings. Hospitals. In a hospital setting, EHRs are central to managing large volumes of patient data across multiple departments, e.g., emergency, intensive care, outpatient services. Hospitals use EHRs to track patient admission details, medical history, lab results, medications, and treatment plans. In critical care environments, real-time data is especially vital for monitoring patients. EHRs help clinicians coordinate care among various specialties, ensuring that patient information is easily accessible by all relevant staff. Hospitals may also integrate EHRs with other hospital management systems, such as billing, inventory, and staff scheduling. Clinics. In a clinic setting, EHRs are used primarily for routine care, managing appointments, and storing patient visit details. Clinicians enter patient information, clinical notes, and prescriptions, often in a more streamlined manner than in hospitals. EHRs in clinics can improve patient-provider communication through portals for appointment scheduling, test result sharing, and even virtual consultations. Many clinics focus on preventive care, such as regular checkups, vaccinations, and health screenings, all of which are tracked within the EHR system. Long-term care LTC facilities. EHRs in long-term care facilities such as nursing homes are used to monitor and manage ongoing patient care over long periods. These systems help track chronic conditions, medication management, and treatment protocols for elderly or disabled patients. In LTC, EHRs can integrate with care plans, track medication administration, monitor lab results, and provide reminders for routine checks and assessments. EHRs also assist with regulatory compliance, including required assessments, reporting, and documentation to meet quality standards and government requirements. The EHR data entry process, from patient registration to clinical notes. The data entry process in an EHR system typically follows a series of structured steps, from initial registration to ongoing clinical documentation. Patient registration. The process begins when a patient first interacts with the healthcare provider or facility. During registration, basic demographic information such as the patient's name, date of birth, address, insurance details, and emergency contact information are recorded. Depending on the healthcare setting, this information may be collected in person, through online portals, or via phone. Initial medical assessment. After registration, patients typically undergo an initial assessment where clinical staff or physicians enter details about the patient's medical history, current symptoms, and any relevant family history or risk factors. This may include entering vital signs, allergies, and an initial examination. Clinical notes. Clinical notes are entered during patient encounters, where healthcare providers document their observations, diagnostic impressions, treatment plans, and any follow-up recommendations. These notes may be structured or free text depending on the system. Structured data entry allows for standardized and easy retrieval of information, while free text notes allow for more detailed narrative explanations. Often, EHRS will combine both methods. Prescriptions and orders. Healthcare providers enter medication orders, lab test requests, imaging orders, and other directives directly into the EHR. Prescription orders can be electronically transmitted to pharmacies, reducing errors and improving convenience for patients. Updating information. During follow-up visits, patient data is continuously updated. This includes recording changes in the patient's condition, progress on treatment plans, and any new test results. Patient records may be updated in real time or through periodic reviews during the visit. Discharge and follow-up. Upon discharge from a hospital or care facility, healthcare providers document the patient's discharge summary, which includes a summary of the patient's treatment, any new medications, and follow-up care instructions. This data is then stored in the EHR, allowing for easy retrieval during subsequent visits or by other healthcare providers involved in the patient's care. Navigating EHR software and interfaces. Key features of EHR systems. EHR systems offer a wide range of features designed to improve healthcare delivery, streamline workflows, and ensure that patient information is easily accessible and actionable. Below are some of the key features commonly found in modern EHR systems. Dashboards. Dashboards provide a centralized view of important patient information, displaying key metrics such as upcoming appointments, lab results, medication lists, and patient alerts. The dashboard often includes customizable panels that allow healthcare providers to prioritize the data they need to see at a glance. These dashboards are designed to be intuitive, displaying information in a user-friendly, organized manner to help clinicians quickly assess a patient's health status and treatment needs. Clinical alerts. Clinical alerts are automated notifications that appear when there are important changes or issues regarding a patient's care. For example, medication alerts. Alerts about drug interactions, allergies, or dosage errors. Critical lab values. Notifications when lab results fall outside of normal ranges. Preventive care reminders. reminders for scheduled vaccinations, screenings, or follow-up visits. These alerts help reduce errors, enhance patient safety, and ensure timely interventions. They can be configured based on the clinical needs and preferences of the healthcare provider. Decision support tools. EHRs often incorporate clinical decision support, CDS tools, that guide healthcare providers in making evidence-based decisions. These tools can help suggest treatment options based on patient data and guidelines, alert clinicians to potential problems such as contraindications in medications or deviations from care protocols, provide reminders or prompts for necessary screenings or tests based on the patient's health history and current condition. CDS tools can enhance the quality of care by ensuring that healthcare providers have access to the most relevant and up-to-date medical knowledge at the point of care.